my name is Jennifer, and I am a licensed veterinary technician here at WellHaven Pet Health. My job here is to assist the veterinarian with different things that I'm going to show you today, and I help with the dogs and the cats, and we do see other critters here at the clinic. I also am an instructor for Charter College, and I teach in the veterinary assistant program over there as well. Okay.
Here we are at WellHaven Pet Health Clinic.
Hello. Come on into the clinic. Okay. Do you want to just sit right here with her? This is the weight room. Okay. All right. And this, we have our patient here. We're going to take her back into the exam room. This is our weight room. All right. Are you ready? Oh, we can go get a weight on her first. So let's go do that first. Let's go get our weight. Come on. I heard the scales off. Oh, we're just going to pretend it's okay. Hi. Hi, little one. There we go. So we'll get a weight on her first. Okay. All right. So let's go ahead and go back into the exam room. This is an exam table, and my job as a licensed veterinary technician is to start doing a couple of things for an exam. So we got a weight today on Riley, and we're just going to do a couple of things here to check out before the doctor comes in to take a look at her. So this is a stethoscope, and I use this to listen to her heart rate and her lungs. So take a listen, huh? No, it's fine. I can. And she has a very nice steady heartbeat. I'm going to listen to some lungs and make sure her chest sounds good and clear. No coughing. Hi. Good. So we take a listen to that. When we're done with that, we do a few things. We look at the eyes and nose. We take a look at her mouth and her teeth. And I'm checking just like for you guys when you go to the dentist. The dogs also come here and get teeth cleaning, so we make sure her teeth are nice and clean. Good girl. Piece of lint. Then we can take an ophthalmoscope, and I can take this and look into her ears. And there's a little light on there, and I can take this and look in her ear canal at her ears. I know. And it tickles a little bit. Whoops! It tickles. Just tickle a little bit. So we take a look in her ear canal and make sure everything looks good. Oh no, it tickles a little bit. So we'll take a look in both of those ears and make sure they're clean. It does tickle a little bit. And we'll check here and make sure that they're nice and clean. There's a lot of little crevices in there, and so her ears look really good today. We have a flea comb, so the dogs and the cats that come into our clinic, we make sure that they don't have any fleas. And so we take the flea comb and we check that and make sure she doesn't have any fleas. And she has a little bit of hair that comes off with that, so that's okay. But we aren't seeing any fleas, so that's good. And then sometimes we do take a temperature, just like you would at home, although this temperature, we do it a little differently, but again, we make sure that she doesn't have a fever and is feeling sick, and so we will take a temperature and make sure that that is normal. For dogs, their temperature is a little higher than people, so normal is like 100.5 to 102.5, which would be, we'd be kind of sick with a temperature like that, but dogs and cats, it's a little bit higher for them. So We're not going to do that today to Riley, but that would be something else we would check. And then sometimes our dogs come in and they get their nails trimmed. And so we're checking, I know, she's got some pretty long nails there. Maybe at some point we would trim those nails up. But when you come in for an appointment with your dog and cat, is something we can do is take a little nail trimmer and we do trim those toenails. Just feels better when they're short and not long. So we want to make sure that that is taken care of. So you want to make sure your pet's nails are short, and that helps when they're walking. So we will take little nail trimmers and clip those as well. So those are a few things that I would do for the veterinarian. I ask some questions of their owner and make sure she's eating and drinking normally, make sure that there's no vomiting or diarrhea, coughing or sneezing, making sure that she's eating the way she should be and on a good diet. We check her medical records, just like you do at the doctors. They look at your medical records, and she gets vaccines, just like people do. And so we will check her records, and if she's due for any vaccines, we'll pull those up, and I'll show you what that looks like. She doesn't need any today, but yeah, she gets a little poke too, just like you would at the doctor's office. So Riley looks pretty good, and so she's all ready to see the doctor today. So this room right here is our cat room, and so these kennels here are for when we have kitties that come into the clinic that may not be feeling well, or they need to be dropped off and seen a little bit later during the day. So these kennels, you want to go inside and show them the kennels? So they're not super happy about going into a kennel most of the time, although it's not terrible, it just kind of can be a little scary for them. So we try to go nice and slow, put them in the kennel. And this right here is for a piece of paper that has the patient's name on it, and so we know who is in the kennels when we need to get them out and maybe do some treatments on them later on. So they can hang out with us here and be safe in a kennel. This is our surgery room here. This is where all the sterile surgery takes place. So this room here only has a few things in it. The surgery table is here that the patient will sit on, and the doctor can do surgery here. The anesthesia machine keeps the animals sleeping so that we can do surgeries and they don't feel anything while surgery is being performed. We do spays and neuters. We also can do other surgeries that our patients might need. But again, this is our surgery room where there is some equipment here that we use. We have some needles and suture. I have some drapes and instruments that are placed in sterile pouches. So if the doctor needs to use something like that, it's in these drawers. The monitoring equipment here, so I monitor heart rate and respirations and make sure the patient is doing well while they are under the anesthesia, sleeping during the surgery. I hook them up on IV fluids, so this is an IV pump, and the fluids are for the patient. They get them during the surgery so that they can stay well hydrated. And then in here is all of our surgery packs. So when the doctor needs a special tool or instrument, they are in the surgical packs. So these are sterilized. So everything inside here is clean and ready for surgery. The doctors also put on gowns and gloves. They wear hair bonnets to keep all the hair out of their face, and also hair out of the surgery site when we do the surgeries. So the doctors here have gowns inside that they can put on over their scrubs like I'm wearing today, so that they are very, very clean and safe when we're doing the surgery things.
Okay.
Okay, so this room here is the x-ray room. This is a place where if your pet needed some x-rays done, that we would take them, and so I put on protective gowns and gloves to protect myself when we're doing radiographs with the patients. So the dog and the cat would be on this table here, and we would hold them in place and then shoot an x-ray. So when the x-rays are taken, they come up here on the screen, and I will show you an x-ray of my cat that we took earlier. So this right here is Maui's tail, and Maui had a tail injury that we needed to take an x-ray of and make sure it wasn't broken. So this right here, can you see my cursor okay? Kind of? Can you see me? Yeah. Okay, so this right here is his pelvis and his back legs. Okay, and this is his spine and his long tail. So the reason it's just kind of his back end is because we were looking at the tail and we were looking for an injury there. You can see some other things on this radiograph. This right here, the circular shape, is his bladder. So that is a organ that we look at as well, the bladder and the intestinal tract. And like I said, this is his pelvis and spine. So we're looking at him laying down on his side. Another picture that we took, this is him on his tummy. His head's gonna be up here, which is cut off on the x-ray. Again, I didn't need his top half, but I needed to look at his tail. So his little legs are kind of frog shaped there a little bit. Again, this is looking at him through like his tummy, and his tail goes this way. We put a marker in there that tells me this is his right side. That is his foot there that you see, and his leg bones there, his pelvis and his spine. And I see a little bit of his tummy. He's got some food there in his intestines. And this is his left leg that's kind of coming off the screen there. And this again is his long tail. So again, we just kind of let him sit there, and we were looking at this area here on that radiograph. All ready?
Go.
Go. Okay. So this is where we do lab work. This right here is a tube that we took a little blood from a patient today. And these are the instruments that we use to check for disease and illness in blood and urine. So we run these machines, and we can do that while the patient's here. So we will take those blood samples and run the tests on the machines, and then it gives me some information here that the doctor will take a look at, and we'll make sure that the animal's healthy. If not, then the doctor knows that as well, and we kind of go from there. So all these instruments here, I have a microscope here that we use as well. So again, all this stuff here is laboratory work that we do tests in the hospital. Okay, so in this area here, we talked about looking at Riley's teeth. So this is where we would do a dental. And the animal is, or the patient is put under anesthesia, so they're sleeping while they have their teeth cleaned. We do radiographs, just like you guys would do at the dentist. This takes the pictures of the teeth, and here I have a skull. This is pretend, but it is a skull of the dog, and it shows you all the teeth they have inside. An adult dog has 42 teeth in there, and so this is what it looks like. We use this for practicing how to take good radiographs, and then we actually would do this on a real patient. So this little apparatus here is what we would use to take the picture, and we take a picture of that, and then it pops up here over on our computer. And I have pictures here. This is of a cat. This is my cat's teeth. And so this here is a picture of the upper teeth and the canines, some lower teeth, and you can see the roots here that sit underneath the gum line. You can't see that unless you take a radiograph. And then here's some bottom teeth, those little itty bitty bottom teeth and the big canines. And that right there is an upper canine. That is that big tooth that most of you probably see on your dog and cat if you were to look in their mouth. So we take radiographs to make sure that the teeth are healthy underneath as well as on the top where we can see. So again, this is the machine that we use to take radiographs. So when we're done with that machine, we took all the pictures that we need. I can move that out of my way. We will go ahead and use the machine that cleans the teeth. And so I have a lot of pieces in here that we use to clean teeth. So these are put on the machine, and I have a pedal that I use, and we would scale all the tartar off and get those teeth clean with the scaler. And then I have another piece that we use for polishing the teeth. So I would put, there's a little rubber piece that goes on here, and we polish up the teeth. They're nice and shiny after that. Sometimes an animal needs a tooth pulled because it's not healthy. And so we have all kinds of instruments here that we use to pull teeth. And so these here are sterilized just like in surgery, so they're nice and clean for each new pet. And then we use those tools here, checking under the gums, and this one helps me pull teeth, and this one does too. So we use these here when the doctor thinks that the tooth is very loose or has been diseased and we need to pull that out. And then the animal feels a lot better when they wake up. Their mouth isn't hurting anymore. So that's how we take care of that in our dogs and cats. And so they wake up and they have a nice smile when we are all finished doing a dental. Okay, so this back here in our treatment area, which is what this space is called, where I showed you where we were doing dentals, the patients like Riley, our dogs and cats, will come back here on the exam tables. The doctor will do their exams. We will do other treatments that the animal needs back here in this area. If an animal needs to come stay with us for the afternoon, we put their names on the board. So if Riley was staying with us and she needed some things done, I would put her name up there. She is a canine, so that is shorthand for canine. I would put her weight in that little box there, and maybe she's here for an exam and vaccines. Okay, so I would maybe put a little checkbox there and make sure that we would get that done at some point during the day. And then maybe her mom's gonna come pick her up at 4 o'clock in the afternoon. So this board we use for a lot of things. We communicate with each other when we need to call the lab for picking up samples. There's just a lot of things that we do back here that we need to keep track of. We need to order things when it gets low, like vaccines and medications that we use. So this board here is called the treatment board, and that is what that is used for. It's right there if you need. Okay, so this back here, we keep some food just in case the animal is sick and needs to go home on a special diet. So these foods are specially made for a patient, dog or cat, that might need something to help their tummies, something for good bladder health, something for good kidney health, just to help them out. So they do eat special diets. This is cat food. These are our dog foods. These are dry, and we do have wet. So we do have canned food as well. Sometimes they're overweight, and they need to go on a diet, so we have special diets for that. Same with our kitties, and so these are made by a special company, and the doctor prescribes these diets for our patients. Okay, so at the veterinary clinic that I work in, this room here is for doggy daycare. And so when the moms and dads go to work all day, the pets come in here and they get to play with each other. So it's at the end of the day and we're kind of cleaning up, but we had about 5 dogs here playing today. They had a good time. Those little ramps over there, we put them down so the doggies can run up and down, and we throw the balls and the toys so that they can play. They eat lunch in here. And like I said, we have somebody in here that plays with them all day. So they come and hang out with us when, so they don't have to be home alone, and they have a fun time in here.